Hello friends, welcome to my vlog. In this vlog, we'll be interviewing Mr. Rajesh Matthew. Rajesh is a close friend of mine. I met him first in 2009 when we were studying MSc. We hadn't had a chance to study together, but I know him from 2009. Rajesh has worked in All India Institute of Medical Sciences, Delhi, from 2011, and he migrated along with his family to Australia in 2020. So in this vlog, we'll be exploring what is the registration process under the new system, that is outcome-based assessment system of registering in Australia. So we'll explore more about that through this interview, and also the NCLEX exam and OSCE exam also we'll talk about that. So doing Regis, my first question will be, as you and your wife both are working in All India Institute of Medical Sciences for 10 long years. Yeah. So what makes it to think that you need to step out of India and migrate to the Western country?
Yeah, before that, thank you, Ashish, for introducing me, and thank you all who all are watching us. Yeah, it was what you are saying is true. All India Institute, it's a premier institution in India, and me and my wife, we both were work there almost around 10 years there, and it's a big facility, a lot of exposure there, and but finally when we look around, especially my kids, they were a bit difficult to cope up with the climatic condition in India. It was around extreme weather condition in India. So, and after we worked around 10 years in AIIMS, we were also thinking we have to move on. Okay, we have to move on, and many of my friends and many of my relatives are working in Western countries, and so we also thought we will also give a try. So that is how we migrated to Australia.
Okay, so it was just for your kids' future you are looking for?
Especially mainly because of kids, their education, and the climatic condition in Delhi it was worsening day by day, and so we were thinking okay, we'll just move on.
Yeah, because many people who are studying nursing in India, the most secure job in India, that is central government.
Yeah.
And all in medical science is top in the list.
Yes.
Maybe how many people are applying, only 1% or 2% of that are able to qualify.
Yeah.
And you and your wife both were able to qualify.
Yeah.
So that's a really secure job, isn't it?
Of course, it was a secure job there.
Yeah, and we additionally, along with the salary that is top notch, you have additional facilities. So by migrating to Western country, do you had a thought that I'm missing all of my 10 years revenue, 10 years whatever I had served to the government, I'm going to lose that? What was your thought process? Because it's not easy at all to step from a very comfortable zone. You're already in central government job, your wife is settled, you were settled there. So moving from coming out of that comfort zone, how easy or how difficult it was for you?
It was very difficult and it was very risky as well. It was a big risk actually we both of them we were working in AIIMS, and to quit that job and migrate to a totally different country, it was a big risk. But anyhow, I was very keen to go to a Western country, but my wife, she was not. So anyhow, I convinced her, and finally she had done her bridging course in Australia, and after she had done her bridging, she was a bit more convinced. Anyhow, we worked there in Delhi for 10 years. Okay, now we will think about for going to overseas. But it was not quite an easy job. Anyhow, wife, she moved here, and when I moved here, the bridging program, it was the registration process earlier, it was totally changed. It was totally changed to OBA, that is outcome based assessment, and and what happened is, and the COVID also came, so it was a struggling period for us.
Yeah, so as you qualified through the outcome based assessment in order to get your registration.
Yeah.
So my next question will be around that. So if someone is not knowing what is the process, like what is outcome based assessment, can you just debrief us about that?
Yes, as I mentioned earlier, for the nurses it was bridging program earlier to get a registration in Australia. So now in 2000, after 2020 they changed to OBA, that is outcome based assessment. In that it's not that expensive as bridging program, but the candidate should go through two exams mainly. That is, first is NCLEX and the second is OSCE, that is Objective Structural Clinical Examination. So it's basically, when we say that, it's one is theory exam and one is practical exam. We have to clear both these exam in addition to the English proficiency test.
Okay, so
Yeah.
process goes like that. First, you have to pass either IELTS or
No,
OET,
it's not like
PT.
that. Yeah, the difference is in the bridging program, we have to get the English proficiency test. We have to clear that test first, then only we can go for the bridging course.
Yep.
But in OBA program, we can do this English proficiency test after clearing the NCLEX and the OSCE. Yeah.
Wow, that's
Yeah, it depends upon the candidates. Some of them will go for the English proficiency test first and then go for this OBA program.
okay.
But there is a, like, it's a risky process, like if we are getting the OSCE dates bit late, or we cannot predict now because of COVID and all this stuff. If once we clear the OSCE, that time we should have a valid English proficiency certificate. So what I am saying is, like, after the NCLEX or after the OSCE, we can go for the English proficiency test and we will get the registration finally.
Okay,
Yeah.
so process is like either you clear first you have to clear NCLEX
Yes.
and then OSCE,
Yeah.
and after that if you're not qualified English proficiency, you go for that and then registration process.
Yes.
Okay.
Yeah.
So yeah, you clear NCLEX in first attempt.
Yes.
That's very rare example. Isn't it? So what strategies and techniques you use that that help you to crack NCLEX in first attempt itself?
Yeah, NCLEX, when I prepare for the NCLEX, I just refresh the basics. And I have prepared from, mostly I have prepared from Mosby and Saunders, the latest edition. And also I have gone through UWorld. There is one portal called UWorld. That is also good for NCLEX, preparing for the candidates who are preparing for NCLEX. And the other one is called NCLEX Review. Sorry, not NCLEX Review, it's Archer Review. And so I have I prepared from these four, mainly two textbook, Mosby and Saunders, and there's two web portals, that are Archer Review and UWorld.
So if somebody want to prepare for NCLEX, which subject they need to focus more, or is same weightage for all the subjects?
It's same weightage for all the subjects, I will say.
Oh,
Because
so
when I have done my NCLEX, they asked from geriatrics to research. So it's we have to cover all the topics.
Oh,
Yeah.
that might be difficult.
Yeah, it might, but it's possible. It's, if we prepare for me, it took me around 3 to 4 months for preparing for the NCLEX. Some of them prepare for just 1 month. It's up to our our ability.
Yeah, because you are from medical surgical background, so that might have helped you.
Yes,
to
of
great
course,
extent.
but NCLEX is not only concentrating on medical surgical. It will concentrate on all the topics. From pediatrics to research. They will ask.
Yeah. How many hours you studied per day? Any rough estimates of that?
I would say it. I took around three hours per day on an average. Yeah, and in the final stage, I covered around 50 to 75 questions per day.
Per day. Okay.
Yeah.
And have you got any mock test? Gone through any mock test or something,
Yes,
just to test yourself?
yes,
Also,
yes.
which forum you use most
I
commonly?
use this UWorld,
UWorld.
Archer Review. Yeah.
Okay, and that help you to.
Yeah. Yes.
And the consistency of the questions in actual exam and the U world is more or less same.
I would say Archer Review is more same.
More similar.
Yeah, that's what I felt. But I will definitely say to the candidates that they have to go to UWorld also. So after doing the UWorld assessment, then you go for the Archer assessment. So we would think like, yeah, it's more easy. We can able to achieve this.
Yeah.
Yeah.
So after NCLEX, now you got, once you clear the NCLEX exam, next is OSCE.
Yes.
So what is the nature of OSCE exam?
OSCE is actually it's a practical exam, and OSCE actually NCLEX, before that I will tell you like NCLEX we can do it from anywhere in the world.
Oh, yeah.
Okay, yeah, we have centers in India, we have centers in Gulf countries and all. But for the OSCE, the candidate should come to Australia.
Australia.
And in Australia, there is only one center, that is in Adelaide.
Where you are now.
Yeah, where we are staying now. And the University of Adelaide has a clinical stimulation lab. There, they will conduct this OSCE. So OSCE is basically it's a practical exam, and they have got 10 different skill stations, and so each stations have different assessment. So as we have signed for a mutual confidentiality agreement, I am sorry that I cannot say like what are the scenarios inside the each station, but it's mentioned in their OSCE handbook by AFRA, and so each station has got different scenarios. So we will get around 10 minutes. In that 10 minutes, 2 minutes is the reading time that is out of the station. Out of the station, we will get 2 minutes to read that scenario. There's a small display out of the station. After reading the scenario, after 2 minutes, we have to enter. From entering, our time starts. So it's the total span of 8 minutes in one station. So from the introduction to the patient to the final documentation, we have to done in that 8 minutes. At the before in the last 2 minutes, they will give you a alarm. That the assessment will finish in 2 minutes. So we have to just finish it off, and we have to go to the next scenario.
That might be challenging, isn't it?
Yeah, it's challenging and it's stressful, but yeah, it took around 2 hours to complete the entire stations, and yeah, it's challenging.
So, like someone who is coming from India or South Asian country, where there is a wide gap between what is taught in the classrooms and what exactly practice in a clinical setting.
Yes.
We have very wide gap between theory and practical in developing countries, and specifically in South Asian countries is more wide. So, like, how one should prepare?
Actually, Ashish, it's a very good question. Actually, I have around 13 years of hospital experience.
And that in AIIMS.
Yeah,
It's one of the standard institution in India.
AIIMS. I have seen a lot of cases there in AIIMS. But the problem is when we come to Australia, the Australian AFRA is expecting us to do a procedure according to the Australian standards. In their side, it's right. But we are not used to those standards. So we have to prepare for the OSCE. Definitely, we have to prepare for the OSCE. And I have done my training in one of the private institutions. Many of the private institutions in Australia are giving this OSCE training. And I have done through private institution called NETA. And they have also had they already have different centers in Australia, and they have good trainers. And there are many other good institutions also all over Australia. So my humble suggestion to the candidates is, it's better to go for some training on OSCE. And there are certain few candidates, they haven't done any training, and they clear the OSCE. But it depends. According to me, my clinical skills is not. I don't know much about the Australian standards, how to do a procedure, what is the protocol. I don't know. So it's better if we are coming from overseas. It's better to go for a train.
So, any centers in India or in?
I don't think so. I am not. I'm sorry. I am not much aware about that. But if anyhow the candidate should come to Australia for the OSCE exam. So my suggestion is, just go for any reputed institutions. Those who are well trained in their OSCE preparation. And just go for their 1 week of face-to-face training, and then go for the OSCE exam.
Okay, so I don't want to ask which institution when you went for OSCE, but how much estimated cost involved in post preparation for coaching?
Yeah, it depends upon institution to institution. On average, it costs around I would say like around 3,000 to 4,000. It will cost.
$3,000 to $4,000. Yeah, and then and after how much is in cost involved in registering one for OSCE exam? or is it full package? How?
No. I was saying about the OSCE training fees. Okay, the package of OBA is around $5,000.
That includes.
That includes the NCLEX fee, OSCE fees, and all the other assessment fees by the AFRA. If you are asking me about the OSCE fee, it costs around $4,000, and NCLEX and other assessment fee will cover around $1,000. So it total cost is around $5,000. But don't think that okay we can finish out of this program in $5,000 because I was in Adelaide, so I just spent for OSCE training. But when one candidate should come from overseas, they have to pay for other expenses also, like flight and other visa charges, all those stuff.
Yeah. So OSCE. So there are 10 stations are there.
Yeah.
So how many stations one should clear, like in order to get passing marks?
Yeah, they should get at least 7 out of 10.
70% passing.
Yeah, yes.
That's a high. It's
Yeah,
like
it's-
IIT is a 75%.
It's stressful, and when compared to UK OSCE, the time we have some time constraint because it's just 8 minutes we have to do the
Procedures.
Yes.
Yeah. So after OSCE, suppose some student fail in OSCE, so what's the next for them? Like how many attempts one can take in OSCE?
In my knowledge, there is no any specific number of attempts in OSCE. But if one candidate fail for the OSCE, they can apply for a second
Next-
sitting.
And how, like once you pay $5,000 as an entire package, like for NCLEX and OSCE, then someone fails in OSCE, so he has to rewrite NCLEX or just write OSCE again?
No, OSCE, it's not about the package actually. We are not paying the 5,000 amount initially. We are just paying for the assessment fee initially.
Okay.
And
so-
then we are paying for the NCLEX,
Okay.
and then we are paying for the OSCE.
Okay.
If we couldn't clear OSCE, we have to pay for the OSCE,
OSCE again.
That is
Okay.
4,000. We have to pay it again.
Oh, okay.
Yeah.
Yes.
But we won't get the date on the next cycle. If I fail in my first attempt, I have to the waiting period of the OSCE result is 8 weeks.
Oh.
Okay, and I think it's same for the NCLEX also. We have to wait for 8 weeks to get the result.
That means 2 months waiting time.
Yes. So once the result has published and unfortunately the candidate fail, what they cannot get it. It's in the AFRA website also they are saying we won't get the date on the next cycle. They have to wait for one more cycle, and then we'll get the date on the. If we are fortunate enough, we will get the date on the next to next cycle. Otherwise, it depends upon the AFRA about how many candidates are appearing for the OSCE.
Yeah. So, yeah, it looks like it's very structured process, and every exam need to be clear in order to get into the next.
Yes.
set.
It's a step-by-step
Step-by-step process.
exactly.
Yep.
Yes.
And once you clear OSCE now, so what is the next after that?
After the OSCE, we have to submit all the academic documents, and we also should get from the good standing certificate from the nursing council
Where we were.
where we were studied or where we worked. And so once the good standing certificate reached in AFRA office, then that's the formality. We will get the registration.
Outcome-based assessment.
Yes. And one more thing I have to add on this is earlier, for you and all, like the from the council they send it by post.
Yes.
But now AFRA is giving a good facility. Like even the council can send it through mail.
Okay.
So we should not wait for the 1 month to get the post to receive by the AFRA. They can send it by mail.
Yeah, so
Yeah.
that good standing certificate you mean?
Yes,
Yeah,
yes,
so
good
now,
standing.
yeah, during my process I completed from bridging. My system was old for registering in Australia. So it was post system and it was taking around 3 to 4 weeks in order to
Yeah,
get the good
exactly.
starting certificate from respective nursing council
Yeah.
to the APRA. So, but now for Regis it was through mail.
But unfortunately, my council they send it through post, but there is that facility also. They can even send it through mail as well.
To make the fast track registration
Yes,
process.
yes,
That's why
yes,
they are
yes.
accepting that one. Yeah, that's a good step. Like now, Regis, you are almost completing 2 years, isn't it, in Australia?
Yeah.
So, what difference you find because you were with the family working in Delhi, and you're working in Australia in Adelaide from last 2 years. So, what difference you feel between the two countries?
Two countries. It's I feel that work culture is a bit more different, and like it's anyway the Australia is following a Western culture, so that difference is always there, and about the children education also, it's totally different here. So there there is advantages, there is disadvantages too.
So, yeah.
Yeah, but I think it's a friendly country, and there is no, I didn't feel any bias, like racism or anything here. So
Yeah.
it's a good friendly. Anyone can come here and you can work. It's a good working environment here.
Like now, you and me both are immigrated after our mid 30s.
Yes.
So, yeah, how difficult or how easy it was for you? Because someone who's coming after in 20s, late 20s, for them is a bit easy to accommodate themselves with a new work culture. But for us, like for example, I just want to take your view. Like after mid 30s, how it was for you to starting from the scratch all over again. Because you were well settled in Delhi, you had a
Yeah.
very good job in Delhi. But again, how you managed to start from scratch again with the family?
Yeah, to move to one place and to another place, it's difficult. It's difficult and challenging. But here, after moving to work, the staffs, they all are very friendly, and even the social life is also, it's very good. Like it's not like so challenging and all. It's not like that. It's very good, and we can easily adapt to this.
This country.
Yeah, yeah. Especially, actually, we were like thinking like how the kids will survive here. Like they were studying in Delhi, and they used to speak Hindi, and they are not that much good in English. So I felt like how they will survive here. But they easily adapted. Easily adapted. Like what I would say, like it's. They adapted much more than us.
Yeah,
So
yeah.
yeah.
Yeah, so when you landed here, like when you landed the first time with the family, anybody was with you to help you to, like any friend was here that helped you or assisted you in order to just initial settlement? How the process was for you?
My brother, he's in Sydney, and even I have two cousins in Melbourne as well. So when we came to Melbourne first, and my cousin, she helped me a lot. And when we reach Adelaide, we have some friends, and so here they help us a lot. So when uh, that's what I felt here. When a new immigrant come here, many of them are there like to help
To help you?
us. Yeah,
Yeah, that's the one.
because each of them struggled a
Struggle a
lot to
lot,
settle
yeah.
here. So everyone will help.
Yep.
Yeah.
So that's the one. You need to point it down, guys. So if you are coming here, just find someone who can help you for initial settlement, because
Yeah.
that initial one or any, like if somebody is really planning to think about moving abroad
Yeah.
after 30 mid 30s, what would be your advice to them?
Uh, they can. It not depend upon the age. The age depends when we are planning for the PR.
Yeah.
Our PR score will affect. But if we are planning, because as you said, we also planned after our mid 30s. So it's a good country, and we can move on. But especially for the nurses, I know many of the nurses are struggling to get an Australian registration right now because of this OBA process is quite challenging. That's what I felt, and
Yep.
many of the nurses are feeling that way also. So there are some conversion programs here. They can go through that way also, especially like those who are having PR here, permanent residents in Australia, and they are still struggling to get an Australian registration because many of them couldn't, clear NCLEX, or many of them couldn't clear OSCE. They can also go for some conversion programs. Many of the universities are doing graduation nursing program that we are because based upon our qualification and experience back in our parent country, they will give credits and we can directly go through the third year of the course. Okay, but
Yeah.
only thing the candidate should look that like those courses are directly leading to the nursing
The
registration,
registration,
because
yeah.
many of the universities they will give that course, but that doesn't leads to the nursing registration. Okay, so there are some universities in Australia they are giving this conversion programs, and they can also many of the candidates can go through that way also to get a nursing registration.
Yeah.
But for an it's what I'm saying about the domestic students, because PR holders and citizens are coming under domestic students
Domestic,
here.
yep.
But if it's an international student, if an international candidate, the expense is much more.
Much more,
Much
yeah.
more.
Around
For domestic, it's just around $4,500. But when an international candidate comes, it costs come around above $30,000.
Above 30,000,
That's the
yeah.
difference.
Yeah.
Yeah.
So that's the benefit of having permanent residency
Yeah,
in
that's the
Australia.
benefit of having-
Crack
Yeah.
NCLEX and OSCE.
Yeah.
That means that if you are not able to qualify those exams, you
Yeah.
can go for third year of bachelor degree
Yeah.
in uni
Yeah.
by paying it. If you are coming from overseas, you need to pay international fees, which is around $33,000 to $35,000
Yeah,
per year.
Yeah.
And if you are already have PR, in case of my wife now, she has PR, so she can go for directly as a domestic student, and
Yes.
she can get the license within 1 year.
Yes, yes.
By paying $4,500,
Yeah.
which is equivalent to OSCE and NCLEX fees,
Yes,
isn't
yes,
it?
exactly. The only difference is we have to study for
So
1 year.
study for 1 year.
But
yeah.
here the study means we have to go to the college for 2 to 3 days in a week, and rest of the days we can work.
Yeah.
So that's the difference.
That's the difference.
Yeah.
Yeah, thank you, Rajesh. And I would like to ask, this question will be, because very important, because you took a very big risk to quit AIMS job, and 2 years before.
Yeah.
Now you are in Australia for last 2 years. Did you find that it's worth to take a risk after mid-30s, quitting a job which is central government, having so many allowances and benefits associated with that, quitting that job and coming to the Australia? Do you feel that risk worth?
Of course, it worth. Every risk counts. So it was we were very comfortable back in Delhi in our working environment. The staffs, they were very supportive, and there are a lot of cases there which we can learn, because most of the cases are referral. It's not like it was like that.
It's a tertiary hospital, so
it's a tertiary hospital, but finally, like, we worked around 9 years there, so we were thinking like, let's move on, and, but it was a big risk, as you said. It was a big risk, but finally, every risk counts, and now
you reach where you wanted to be.
Yeah, the problem in India mainly is like, what I learned from here is there are different pathways here. Because
for
in
career
India
progression,
we don't have that much of pathway. Even there are different pathways. We can go according to those pathways as we wish. So it's there are many things we have to learn it from Australia to the clinical situation in India as well, and we have to also learn from Indian system also. Yeah. Mainly what I felt is like here, even in India, in CMC and all, the tutors or the clinical instructors, they are working both the sides.
Both the side, yep.
They are working in the hospital and they are teaching the students.
Yep.
That makes a big difference.
Yes, I agree.
And here also they are doing the same.
Same thing, yes.
Same. But many of the institutions back in India, the lectures are confined to the nursing colleges, and so there is no, we are saying like there are a lot of collaborations, but it's not like that. If one who are teaching something to a student, in the same time they should get the clinical experience also.
Yeah.
Okay, so that is much more effective. That's what I am thinking. I don't know.
No, that's the reality, because here in unis, most of the teachers who are teaching to the students of nursing practices and clinical things, they should be clinically placed somewhere. They should have current clinical experience. That's the thing I think would like to mention here, that if somebody is planning to get registration in Australia and they are finding it difficult, to get to the NCLEX and OSCE. The alternative pathways they can go to UK, isn't it?
Yes,
They can go to UK, work there for 2 years, and UK OSCE is
it's challenging in UK, but that's what I heard. But it's not that much stressful than
What we
in
have.
Australia.
Australia.
I think so. Because when one comes to UK, it's easy for them to get a New Zealand registration.
Yep.
Yeah, that is what I heard. And from the New Zealand, they have
can come here.
they can directly convert to Australian registration.
So if you are planning to come to Australia and you are finding it difficult to come and land here because of registration difficulties, someone like you can try for UK, get CBT and OSCE clear. That it's not NCLEX like what we have in Australia. It's a CBT exam, and after that OSCE, and then you have to practice there for at least 2 years. I think minimum requirement is 2 years, and they can.
There are different pathways. There are different pathways. Even they work for around 1 year there. Even there are pathways like they can get to the New Zealand registration directly. But I don't know much about in detail. What I understand is there are different pathways.
Okay.
Yeah. And no need of OSCE for them. No need for
any registration.
For them.
Yep.
They can directly get the New Zealand registration, and from the New Zealand registration they can transfer that registration to Australian registration.
Yeah.
This is what I know. There are a lot of things we should get into it. Like when because OBA program I know know well enough, but the other pathways and the other way of registration, the candidate should
explore more on that. I think once you are registered in UK or Ireland, you can register yourself with New Zealand Nursing Board, and then from there, once you register with New Zealand, I think it's easy to convert that into Australia. So this is another pathway to come to Australia if you find it difficult to land in Australia. The salary of nurses in Australia is around 3.5 lakh starting. It depends on which grade you are coming here. So around 3.5 lakh, that's starting salary, and then you can reach up to 5 lakhs in a month, depending on how you progress your career. So that's all about the nursing registration process. Guys, if you have any questions, please do let us know. I can answer about the old registration system, that is bridging, and Rajesh can answer about OBA system. So please do, if you find this video has help you in some way and assisted you to get the knowledge that you are looking for, please do hit the like button and subscribe my channel and please do hit the bell icon so that you can get notification whenever I upload the videos. Thank you, Rajesh. Thank you for your time.
Thank you, Ashit. Thank you for your time. Thanks.
Bye, guys.
Thank you.